Well, students, today we are going to get to know another important bacterial disease known as syphilis. Syphilis is a highly contagious disease that's mostly spread through sexual activity, include oral and anal sex. The infected person often doesn't know that they have the disease and pass it on to their sexual partner. Syphilis was once a major public health threat. It can cause serious long term problems such as arthritis, brain damage, and blindness. There wasn't an effective treatment until the year late 1940s when the antibiotic was developed. According to the CDC, the rate of new cases of syphilis plummeted in the year 1990s. In 2000, it reached an all time low since reporting began in 1941. But the disease has been on the increase ever since. The rate of syphilis is increased to 71% from the year 2014 to 2018. Now, why is syphilis caused or what is the reason for syphilis? As told before, syphilis, a highly contagious disease, is caused by a bacterium Treponema pallidum. It is a spirochete, and this Treponema pallidum, when seen in the body, they usually are in the form of the sores, which can be called as chancre, which are usually seen in the genital parts of an individual. One may get syphilis through direct contact with a syphilis sore on someone else's body. This usually happens during sexual activity. But the bacteria can also get into the body through cuts on the skin or through mucous membranes. However, syphilis cannot be spread by toilet seats, doorknobs, swimming pools, hot tubs, bathtubs, shared clothing, or eating utensils. Higher risk of getting syphilis is by having unprotected sex, having multiple sex partners when a person is infected with HIV already. The symptoms of syphilis goes like this. It is usually characterized by three stages, or I can say the clinical manifestation of syphilis is happening in three stages, and that includes primary syphilis, secondary syphilis, we have latent syphilis, and finally we have like the last stage of syphilis. Coming to the first one, the primary syphilis or early syphilis. People with primary syphilis get on the sores on the genital parts called chancres. What are these chancres? They're usually small, painless ulcers. They happen on the genital parts, that is on the anus or rectum, or in and around the mouth between 10 to 90 days after an individual is exposed to the disease. Even if not treated, they heal without a scar within 6 weeks. But the treatment will keep an individual away from the disease from moving on to the next stage. But the problem lies here. What is the problem? Since the chakra develops around the genital parts and it is painless, it goes unnoticed many a times. Even the noticed, people will not be so much broad enough to speak about this to the doctor to whom they are visiting. It is because of these reasons there are many chances that the primary syphilis gets on to the next stage. The next stage we call it as secondary syphilis. Secondary syphilis, the stage begins 6 weeks to 6 months after an individual is exposed. It may last to around 1 to 3 months. People with secondary syphilis usually get a rosy or a copper penny rash on the palms of their hands and the soles of their feet. They may also have different rashes on other parts of the body, and these rashes look like the rashes caused by other disease. People also have moist, wart like lesions in their groin region, white patches on or inside their mouth, swollen lymph glands, fever, hair loss, and weight loss. As with primary syphilis, symptoms of secondary syphilis will get better without treatment. Now, when we speak about the next stage, that is the third stage, Before the third stage, there is another stage where we call it as the latent stage. Now, in the latent stage, what exactly happens is that the syphilis bacteria are still alive in the body, but they do not have any symptoms or signs of the infection. Individuals are not contagious, but by this time, the syphilis might affect their hearts, brain, nerves, bones, and other parts of the body. This phase can last for years. Not everyone who has syphilis will enter this phase of the infection. Some people will go into the last stage where we call it as a tertiary stage or we call it as a late stage. This stage begins when the symptoms from the secondary stage disappears. Syphilis at this point they say is not contagious, but the infection has already started affected your organs. And after affecting the organs, they might bring about the non-functioning of these organs and can lead to death. The symptoms of tertiary syphilis include problems controlling muscle movements, numbness, vision problems, and dementia. Now, as stated before, I said syphilis is a contagious disease, yet as it is indeed a contagious disease. Now we'll move on to get to know the diagnosis for this particular disease. Syphilis, a disease, can be diagnosed by blood test. Even before blood test, this disease can be examined by physical means where the doctor will be checking onto the genitals of an individual suspected for this disease and look for skin rashes or sores called chancres. Then the individual will be going for the blood test. And the usual blood test, which is usually followed, is the VDRL test. The VDRL test is recorded as positive if there are the flocculations around the periphery of the test within 4 minutes. No flocculations around the periphery within 4 minutes indicates the test is negative for syphilis. Apart from this, many tests are being done, one being RPR test, and also we have the slide examination test where the fluid from the chancre will be taken and will be prepared a smear, and usually they'll be using a fluorescence microscope to observe the presence of the spirochete Treponema pallidum. Once we finish off the diagnosis, now it is a need that we need to know about the treatment of this particular disease. Syphilis caused by a bacteria is a serious business. Since it is a serious business, what I'm trying to say is that they damage your heart, blood vessels, brain, and nervous systems. Syphilis can also cause blindness or paralysis, and thereby there is need that we have to treat this disease at the primary stages itself. The recommended treatment at all stages for this disease is antibiotic penicillin. If an individual is infected for less than a year, one may need one injection of penicillin to be cured. But if it is like more than a year, then many doses of syphilis are very, very needed for an individual to get treated for this syphilis. There might be a question where will syphilis treatment work if an individual is pregnant? Yes. If an individual is expecting, it is necessary that the individual who is conceived take an injection of penicillin so that the disease cannot be passed on to the fetus or onto the newborn. If not treated, then it so happens the fetus or the newborn can be very serious and might lead to the stillbirth, birth defects, infant death, cataracts, deafness, and seizures. As told, we take antibiotic, that is a penicillin for the treatment, but there also arises the side effects of this treatment. And the side effects are usually fever, headaches, joint or muscle pain, and this usually lasts for only 24 hours. No matter, it is very important that the disease syphilis is to be treated by taking an antibiotic even though the side effects persist because it is just for a day or two. Thank you.